You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no more dentures. He doesn't think anybody should be wearing a traditional denture. And we're talking about mini implants today with an expert on the topic, Dr. Everett Eklund. Dr. Eklund, welcome to the program.
Well, thank you, Randy. It's a pleasure to be here.
Now, for people that don't know your practice, who's a typical patient and what are the different services you offer? I guess this was your father's practice for many years.
Yes, it was. We really don't have a typical patient, Randy. We might have nurses, we might have teachers, we have young people that come to our practice, we have older people that come to our practice. I love our kids that come in. I love the older people that come in, especially the veterans. We still have World War II vets.
Really?
And the stories that they tell, it's always an honor for me to have them come in and see me.
Okay, good. Now, you're big on MiniDental implants for replacing teeth. In fact, in our green room, you said, I hate dentures. I'm paraphrasing slightly, but you don't believe anybody should be wearing a denture.
I really don't. Even though in our practice, we do extractions, we do fillings, done many dentures, and now we're placing implants in. It's been something that I thought that patients like their dentures. In today's world and what I know now, I know I'm kind of joking about this, but I wish I could take a denture and put it on a table and take a hammer and just smash it.
That's what you said, yeah.
That's what people think of their denture. And I never knew it. And I'm a dentist.
What do you mean you didn't know they didn't like their denture? What do you mean by that? You didn't know?
I don't think patients really want to complain to anyone. They like to just go on with life. They don't want to be bothered with things. And they have their denture. They come and see me. They feel like that they're getting by. But what I found is when I started to place implants and we started to attach the denture onto implants, they were happier. But it still wasn't something where I would see that twinkle in their eye. I didn't see them really having a lot of joy with what I was delivering, and I was really pleased with what I was getting. But then I found out that when I started talking to my patients about not having a denture, but being able to give them a third set of teeth, Randy, to give them something that they could floss, something they could brush, that they did not take in and out of their mouth, all of a sudden I saw them light up. It was no longer the thoughts of having a denture and all of the problems that were associated with a denture. That's when they started to explain things to me, how they weren't able to eat the way they wanted to be able to eat. They couldn't go to a restaurant and sit down and order anything on the menu. Now it was about, what can I eat?
So there are a lot of people wearing dentures where you are.
There's tens of thousands of people wearing dentures. You could probably fill up multiple stadiums with the amount of people that are in our area that are suffering with a denture. Even in my practice, my denture patients would come and go, and I never really realized how many were there until I started to talk and discuss with them that they really didn't need a denture. And it's every single day. I have multiple patients that are either having teeth that are going to need to be extracted because of disease that they've been suffering with for a while, or that they have a denture that I thought was working well. And when I told them about the possibilities of removing that denture forever and be able to have a third set of teeth.
Like a full arch of teeth.
A third set of teeth, something that they would brush, something that they would floss, something that they didn't have to put super poly grip on, something that was theirs to keep. So when I bring this up to patients, they all want this. I can see it's something that's been missing in their life. I can see that what I've been giving them all this years, what I thought was something that
making dentures, you mean?
Making dentures, that it was something that they were comfortable with. I found out that it wasn't. They want teeth back again.
Is this the future of dentistry? That means maybe it's 10 years or 20 years that nobody will have a denture just put on adhesive. They'll all be attached to something. Is that what you're?
As long as us dentists don't get in the way. We're taught that if someone loses teeth, we construct a denture and the patient will be happy with it. But we don't go and see what the patient is going through.
All right.
I don't have a denture. My patients don't want to complain about it because they're getting by, but they're not happy. And when I found that what they really wanted was a third set of teeth, it was eye-opening for me. It was a revelation. Now I can see how I can change lives. And it's very exciting. Just last week, I had a patient who came in, and I've known her for a while. Kind of typical. Life happens. She's gone through a divorce. She's had some illnesses that she's battled, and now she wants to come back. She wants to take on life again. And it's her teeth have just kind of given up. And about 6 months prior to that, we had to extract out the last of her teeth, and she received a denture. It's been comfortable for her. She's been coming in, and about a month ago, I talked with her about, Sally, we have a product in which I don't have to just give you a denture. I can give you your teeth back. And immediately, I could see something transform in her eyes. I could see that this was something that she was just desiring. And we started through the process. And just last week, I was working on another patient, and I kind of felt someone hovering over my shoulder. And I kind of looked back there, and I saw it was Sally. And so I stopped what I was doing, and I got up, and Sally goes, "Oh, Dr. Reck, I have to give you this big hug." And she came and she squeezed me. This is not something that's ever happened when I've done a filling, when I've done a crown on a patient, when I've delivered a denture. This only happens when I can give someone their teeth back. They don't want an appliance that I put in someone's mouth, in their mouth. They want their teeth when they had, like when they were 18. They want their life to be transformed.
Can they eat whatever they want?
Randy, they can go to a restaurant, they can open up a menu, and they can pick out anything on that menu to eat. If it's a steak, they can finally bite through.
But how soon? Okay, so let's say everything works out, right? They walk in, because you told me, in one afternoon, they could walk in without teeth and walk out with a fixed set of teeth. How soon can they eat?
Well, I do tell them.
Ideally.
I do tell them to be careful for a few days. Things are healing. When they had their denture before, they were just kind of chewing straight up and down. Now that they're having their teeth back again, we kind of chew in a side-to-side motion where you can really chew up your food. Because Randy, there are no teeth in our stomach.
Right.
So after a few days, they can go right at it. They can chew like they once did.
Eat whatever they want. How old can you be to get this done? To get dental implants, mini implants?
I've had patients in their 80s that have placed implants, and it worked out extremely well for them. People, their life doesn't end when they're 60. It doesn't end when they're 70. Why do their teeth have to end when they're in their 80s? We can give them back what they once had, even though life...
What's the oldest patient you've heard of doing this?
In the 90s. The organization that I've trained under, 94, 96 is about what I heard.
But are they more likely to have issues if they're in their 90s? Like them falling out or anything like that?
The studies that have been done have shown that the implants are going to integrate no matter what the age of the patient is.
Okay. So backing up, I asked you earlier about, are there a lot of people wearing dentures in your area? You said tens of thousands. So if there's so many denture wearers, why aren't they coming in and getting their dentures or something attached, like to mini implants? What's your take on that? If it's so good.
Patients feel like that they won't qualify for it. They've heard that you have to have a certain amount of bone for the implant to be able to set. They feel like that it's going to be too expensive for them. They're afraid. They don't know what this procedure is going to be like. I've had patients, one patient I can think in particular, she'd gone to multiple other dentists and she was told she did not have enough bone for implants. She did this for 5 years, going to dental office after dental office, and they would give her either there wasn't enough bone or it's going to require extensive bone grafting surgery to be able to get what she desires. She came, she sat in my chair, I took a look in her mouth, and I'm like, we can do this. We do this all the time. And today, she has her set of teeth in her mouth with the implants that we placed. Another reason, if you're wearing false teeth, you don't come and see the dentist. The dentist is the last person you're going to want to see. Often these patients, these people, they've gone through suffering in which they had crowns done, they had root canals done that were failed in extractions. And finally they get to that point in which they've had enough. They just can't take it any longer. They can't chew without things hurt. And even though they really don't want it, they go and they get the denture done. And it's relief. They finally have gotten rid of these teeth that have caused them so much misery. They're not going to come back and see me about their denture.
Welcome to Potomac Dental Center, your neighborhood family dental office. Are you suffering with loose dentures? Are you embarrassed to smile because of missing teeth? Restore the confidence of your smile with a life-changing approach to modern dentistry. Eliminate your dentures forever with MiniDental implants.
A lower denture is horrible. You can't eat, you can't talk, you can't kiss, you can't do any of the things you think you can do. Dr. Red suggested the mini implants with a fixed bridge. It's made a huge difference in my life. I feel like a whole person again. I feel like that I can go out in public and I can actually eat something instead of telling people, oh no, I'm really not hungry, when actually I'm starving to death. I think that this was probably one of the smartest things I've ever done, and I would recommend it to anybody.
MiniDental implants are the simple, affordable solution. We change lives daily by eliminating bulky, loose dentures in one visit with slender, sexy, permanent porcelain teeth. Say goodbye to your dentures today. Call me at Potomac Dental Center and change your life forever.
So let's move on to the denture wear. So if somebody's watching this program or they hear about you and they go in, what is that consult like? Like, what are the options for a denture wear? And then I'm going to ask you questions about people that are about or they're headed to dentures. But first, the denture wear. What are their options?
First, we'll sit down and I'll talk with the patient, and they'll ask me, like, am I a candidate? And so we'll take x-rays and be able to see what things look like radiographically. I'll have them lay back, and of course I'll look to see the way things look in their mouth. And all my patients that I have seen since I've received this training that we're talking about today, they all qualify. I don't have patients that I can't put implants in. I don't have patients in which I have to have extensive surgeries to be able to accomplish.
But back to options. Okay, so a denture wear goes in, they're wearing false teeth, they're in your office. What are their options when it comes to attaching their teeth to implants?
One option is where we'll place 4 implants, and we'll take either a new denture or sometimes their existing denture. We'll put some housings in it made out of O-rings, and we'll take their denture and we'll snap it in place.
Let me see this. Okay, so this is an actual what they would have.
Actual
so
denture.
Lower, like 8 implants or 4 implants.
It can vary.
It's actually very tough to get out.
It is.
Is that an exaggeration, or is this, you can make it as tight as you want?
We have different types of O-rings in which we can tighten it up or loosen it based on patient comfort.
Okay, so it just snaps in.
And it's very popular in our area, and this was a style that I've done a lot of. What's good about these is now they have a denture that's fixed. They can chew, they can smile, they can laugh, and they don't have to worry about their denture coming out.
So there's no more adhesive at this level?
No more adhesive. It's something that now they can get on with their lives. They don't have to worry about having a denture that's going to be loose. But the key word here is denture. They don't have to worry about a denture. And as a dentist, I felt like the problem was solved. But I have found that there's something more that we can offer our patients.
Okay.
I don't have to just limit patients to something that's a denture that snaps in. The other option that we can do is what I call a third set of teeth.
All right.
Now, it's no longer something that snaps in and snaps out. Now, it's a set of teeth that they brush and they floss just like their regular teeth. It's not something that's
Supported by these mini implants.
supported by
Okay.
the mini implants. I have this one patient, and it was told to me by the wife.
Okay.
The wife was saying that she'd been married to her husband for 3 or 4 years. And he was always secretive when it came time to bathroom time. You know, he would lock the door. And she felt it was a little bit awkward, but he was a good man, and so she just like, he needs his privacy when he's in the bathroom. And about 3 or 4 years after they got married, she came into the bedroom and she saw her husband with a denture in his hands. He had been hiding this from her all this time. And now she's coming to me describing this problem that her husband has. Not that he wants a denture that's fixed, he wants his teeth back. And this is what I'm so excited about, that I can transform a life from being in the shadows, being behind locked doors, and now I can be able to take someone and give them their teeth back. I just can't imagine what it would feel like to be able to have to hide that from your spouse. Back to the story about the man who was hiding his denture all these years. I've made a denture for him that he's been very pleased with.
He's living with. Okay.
He's living with right now. He hasn't come back to our office. It'll be a while before he needs a reline or something. And I am so excited because I know when he sees that he doesn't have to have a denture any longer. He doesn't want something that's a denture that he takes in and out. He's still back to the same problem that where he is right now, whether it's fixed or not fixed. He still has to live life with something that he's hiding. He has a dirty little secret that bothers him. Because
So when you get him in that office, what are you going to tell him? Look, let me just give you teeth that don't come in and out.
I'm going to tell him I have good news.
Okay.
I can give your teeth back to you. And from my experience, what I've seen, I know that this is what he wants. And this is something that we're going to move forth, and he's going to be able to come out of the shadows of his life. His wife knows his secret, but I'm sure his coworkers at work don't realize this. I'm sure the people that he may socialize out on the golf course, they don't know this. He's hiding this from people.
So do they look like, do they look like teeth?
They will
'Cause
look.
I always feel like I could spot a denture. So even though it's a fixed set of teeth, do they look good?
What I'm going to give my patients, and what I'm giving my patients, is not plastic teeth, but porcelain, zirconium teeth that are made like out of diamonds. They have the same sparkle to it that enamel has. And that's one of the things that people don't like about dentures. They tend to be made out of plastic. But this will be something like a bridge that someone may have.
So it's not acrylic. This will be zirconia, you say.
This will
So
be
they could
porcelain.
bite and chew. If everything works out, they could eat whatever they want.
As hard as diamonds.
Could they bite with their front teeth an apple?
They can bite right into an apple. They can bite into corn, maybe even some baby back ribs.
Okay. So they could eat whatever they want.
Whatever they want.
And so they just don't know their options. But what about the crowd that they don't have dentures yet, but they have bad gums? That means bleeding gums, bad breath, gum disease. Can they do this? Can they get dental implants, mini implants?
Yes, they can get dental implants. And matter of fact, they're the ideal candidate. Once the teeth are extracted out, then everything becomes healthy. The problem is gone. What they've been working with over the years with gum surgeries and root canals, now that is out of the way. The body is able to heal. We have a wonderful, wonderful site in which we can put our implants in so we can give them that third set of teeth that they've been missing since childhood.
Okay, good. Now we are short on time, but in the green room, we were talking, and you say in your town there's a lot of advertising, and even you do a lot of it, the snap in, snap out. You said, I don't think you said hate, but you don't like a snap in, snap out option for mini implants or traditional implants.
It's
Why?
still a denture. Patients don't want a denture. I want to give people a set of teeth that don't come in and out. It's something that's fixed. I'm talking about a full arch of teeth where they can have that beautiful smile, where they can be able to chew things like they can remember when they were younger. They want their life back. And this is what really excites me. It's not about doing the implants, about delivering a product. It's the patient itself, because I see it in their eyes. I see the way that they hold themselves when they come back to their office, that now they have something that they really want.
So they come back, okay, when it's all done, they get this fixed arch of teeth. They just go to dental, they do traditional dental cleanings. They come in, what, every 6 months?
Regular cleaning, they brush and they floss them. We, a lot of times, will recommend a water pick to be able to clean around the teeth. The teeth are made so that they self-cleanse, just like our teeth self-cleanse. Denture teeth, food wants to stick to it. It's a plastic. There's that little bit of suction that's on it. That's why when we give them a set of porcelain teeth, it feels like their teeth that they once had.
These are not to be confused with traditional dental implants, right? Some may say, some experts, especially knowing you're coming on the show, may say, well, Randy, I don't know about the mini implants. Maybe they're too small. I don't know if they work.
That's just old thinking.
What do you say to that?
The studies have now come out, and we have the data where we've tracked cases where 10,000 implants have been placed, and we're having the same success rate as the traditional wide body implants.
You say they're about half off of traditional implants, but do they work as good? That's my question, really. I keep asking kind of the same question, but do they work as good as traditional implants, in your opinion?
They work just as well. I'm able to provide this to patients without all the trauma of a traditional implant, without all the expense of bone grafting, with all the downtime where we might have to wait for everything to heal. With the mini implant, I'm able to place that implant and put a bridge on it, a single tooth, attach a denture, which really is not my goal.
You don't like the snap in, snap out. You want a fixed set of teeth.
It's what the patients want.
Okay.
The patients want their teeth back. They don't want a denture.
All right. Now, the insurance. I guess insurance here in the U.S. does not cover dental implants. They'll cover a portion of it, right? But insurance, Medicare, Medicaid does not cover.
We have financing that's available, and patients have found that this is not something that prevents them from moving forth with treatment. It's like every patient that sits down, and when I start talking to them about cost is not an issue for this. And my patients are nurses, firemen, police officers. Those are the people that come and seek me out. And when I talk to them about having a new set of teeth that we can fix in their mouth, and I go over how much it's going to cost, it's not an issue.
In fact, you told me over there, you said they may complain about a cleaning price or whatever price, but then you tell them about giving their teeth back and they're like, I'm in.
Absolutely,
Really?
Absolutely. What we try to do is that we break it down so that there's a monthly payment, kind of like buying a car. And it fits in their budget. They're able to get what they want. And in regards to price, mini implants are much less than traditional implants. My hygienist was telling me how she was told that someone was going to have to spend a lot of money. It was so much money. It was like 90% more than what I would charge a patient. It was unreal to me. And it wasn't that there was some bad, evil dentist that was overcharging. I don't think that at all. It was just simply they were doing a large surgery that took a lot of time, a lot of visits to be able to accomplish. With my mini implants, I'm able to place that implant in one visit. So I'm very comfortable with my 90% off fee. I'm able to give something, I'm able to
So are you usually less than the other guys?
always less.
So is this then the future of dentistry? I mean, there will not be a denture wear out there that just has a traditional denture sitting on adhesive. Like 10, 20 years from now, everything will be attached? Is that what you believe?
Yes, it is the future of dentistry. And I'm just so happy to know that patients are going to be able to have something that they want.
So you're doing it right now, every day.
This is what we're doing. This is what we're all about. We're creating smiles. We're able to not just perform dentistry, but we're able to transform lives.
We really are out of time, but final message to a person that's either about to go into dentures, that means they're losing their teeth, or they're wearing dentures. What do you say to them? And they're skeptical maybe.
I invite them in so that we can just have a talk. So I can show them some of their options to see, so they can see if this is something that's right for them. And I am confident that they will see that with the power of the MiniDental implant, we can give them what they want, whether it's a single tooth, whether it's a bridge, whether it's a removable denture, or that fixed set of teeth that I see that people are really desiring, because that's where I see the great transformation in a patient's life. When they've had that denture and now they can go back to something that they really want, teeth that they can brush and floss.
Great. I want to thank you for coming on the show. Very interesting.
Thanks for having me here.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.